I wanted to talk to you today about the blood pressure quality improvement framework. Um, a lot of you might have heard of it, but hopefully I'll just give you a brief overview of what it is and what it can do, and a few examples of how it's being used across Cheshire and Merseyside. So the BPQI framework was locally developed following feedback from Cheshire and Merseyside workshops, and this goes back to about 2016, 2017. And we heard a lot of feedback, but mainly we heard that the way hypertension, even at that time, was being managed was changing. Different groups of staff were managing it. We heard an ask from the wider general practice workforce for templates, but we were also made aware that GPs didn't particularly like templates. We heard that practices didn't really have any way of benchmarking themselves or knowing how well they were doing and how to support case finding. So that was the background in which BPQI was formed. And it was initially developed, but when we had COVID, then we took the opportunity to incorporate the proactive care framework into BPQI. What we have done is that we've built a portal using the link that you can see on the screen, and BPQI can now be easily downloaded from there for Cheshire and Merseyside practices. Come mid-October, it will also be available to all PCNs and practices across Lancashire and South Cumbria too. And what we are also looking at is expanding the data quality support as well alongside of that. So one thing with the BPQI toolkit is that it needs uploading onto practice systems. Most practices can manage to do that themselves very well, but for practices that are struggling, we do have commissioned data quality specialist support that can help you to get up and running. Currently, at the moment, we have 172 practices across Cheshire and Merseyside that have actively downloaded and are using the toolkit. And we do have a more detailed demonstration that takes a little bit longer than the time I've got today. And that there's a link supplied when the slides come out, so you can take a bit of a closer look. So what is it? So the BPQI toolkit consists of a dashboard. There's a risk stratification element to it, but there is also a way looking at the quality of care that's being delivered as well. So I know that that's too small for you to be able to see, but this bar chart here is looking at the NICE quality standards. So you can see, for example, if you are not giving or coding lifestyle advice, you can see if EGFR, certain blood tests, haven't been taken. But what it does do then is allow you the ability to find those patients. There's a little filter button there that will take you straight to who those patients are, and I'll go into that in a little bit more in detail in a moment. So that's one element, it's the dashboard. The next element to it is the consultation template. And as I say, this is targeted at nursing, pharmacy, healthcare assistant staff. It is intended to be a supportive walkthrough of what a good quality hypertension consultation should look like. But for those members of staff that might be a little bit unsure or need a bit more support, it does have sort of walkthroughs in there. So it says, for example, if a blood pressure is above a certain level, please escalate this to a prescribing clinician, etc., etc. So it does have all of that included and embedded within the template. The other thing that comes with the toolkit is a protocol stroke resource pack, and that has sort of links to everything that you can possibly think of in related to hypertension, plus a lot of flow charts and walkthroughs that'll help guide the practice. But it's a really sort of gold standard BP protocol that comes with a toolkit. And alongside of that, there is also a patient leaflet. Now, if the template is used and a target blood pressure is set within the template, what will happen is that you can, at the click of a button, print out the patient leaflet, and it will include the current blood pressure alongside the target blood pressure. So a patient can go out of a consultation with a piece of paper in the hand. Alternatively, if you're doing a virtual consultation, it can be emailed to them, and it has all the usual sort of lifestyle advice and other information. There's also a little space where you could add in at the bottom your own sort of message if you should want to. So looking a little bit more closely at the dashboard and how it connects into the UCLP framework, what you can see here is that we have the 4 priority groups that UCLP identified. This starts with priority 1, which is a BP of higher than 180 of 1/120, down to a priority 4 whose BP is well controlled. And what the BPQI toolkit does is that it will enable you to find who those patients are. So for example, if you wanted to find people in group 2C who is no BP readings in the last 18 months, you can go to this drop down box here, click 2C or 3A as the copy is here, click filter, and it will take you through to this screen. And what this screen, and I know it looks like an awful lot of information there, but you will have, obviously this is cut off here for GDPR reasons, but you'll have the patient's name, date of birth, you will also have the patient's deprivation score set against that. You'll know whether they're BAME, you can see what the latest BP reading is. You can see their BMI, their QRIS, their cholesterol, their EGFR, whether they're on a statin and which statin, and what kind of antihypertensive medication they're on. You can also see what comorbidities that they have as well. The other thing, and I'll just go back up to this screen here, which is very useful, is if you look at this little drop down button here, select group for chart display in the bottom left, what that will do, it will allow you to sort of drill down into this information a little further. So if you wanted to look at those four priority groups for people with dementia or learning disability or deprivation, you can drill down and see who falls into that group as well, and just click filter to find out who they are. The other thing that BPQI does, which I know is of great interest to our primary care colleagues at the moment, is that it will also help you look at the undiagnosed population. There is a tab along the bottom here where you can see it's labelled undiagnosed. If you just click on that tab, it gives you all of these headings, and it's people with a raised blood pressure but are not yet on the hypertension register. So these might be the people that you've got that are hiding in plain sight. So, you know, how has BPQI been received? Well, I've just popped up a few quotes there from our local colleagues that have used it, and as you can see, it seems to be well liked by many practitioners across the region. That's just but a few of the quotes that have popped in there. But what I thought I'd do briefly next is give you a few sort of examples of how it's been used in a couple of different places. So one of the ways that we do encourage the BPQI toolkit to be used is in line with the digital opportunities that are now available to primary care. So what you can do is that you can run your QI toolkit, and you might well want to start with your priority 1 group of patients with a BP higher than 180 over 120. You run the toolkit, you select your patients, and then you can drop them into AccuRx, AccuRx Plus. You can drop those into that. You can select your blood pressure monitoring flurry, send it to your patients, and they can then send it back to you, which will automatically go into the system and filter back into the patient records. And that process is being used quite frequently now in the Wirral. And as you can see, I think one of the first practices we tried it with, and they tried it on their undiagnosed population, found 154 new hypertensives in a 3-month period in their first 3 months of trying it. The other quick example that I'll just give is in Healthier South Wirral. It's a PCN that we've been working very closely with, and they have a very engaged health coach that has supported this group piece of work, where they look at where they run the QI toolkit. They've come at things slightly differently, in that what they do is that they run the list of which patients they are calling for review for the week. A prescribing clinician takes a look at that list and the latest BP readings that they have recorded, potentially makes any suggested medication changes, and that person then sees the health coach. And as you can see, we are beginning to sort of see large drops in the number of hypertensives in high priority groups, and we're beginning to see them move down the list of priorities. So that's just a way of sort of divvying up the skill mix in primary care, just to try and cope with the huge burden that you've got on you at the moment. And there's a lot more detail around that, and I'm happily chat through to anybody that wants to know a little bit more. So I'm going to stop sharing there.